our body, what are they detecting and picking up? Oxygen. Okay, they're detecting oxygen. A COPD patient, do I want to put them on 100% oxygen? No. It's because why? They can't get rid of what?
Carbon dioxide.
Carbon dioxide. We have too much carbon dioxide. There's no more room for oxygen, but 100% oxygen will not help. If a person has low oxygen levels, we already know, well, erythropoietin is going to cause more red blood cells. But in the lungs, what's going to happen to your respirations when your oxygen is low? Increased in rate and increase in the depth of your respirations. You guys will talk about pH can affect your breathing, stretch can affect the breathing, pain and irritation can also affect your breathing. There's just some miscellaneous things that can cause changes in respiration. All right, so back to that pressure in the lungs. So the diaphragm goes down. What happens to the pressure inside the lungs? Does it go low or high?
Low.
Low. So it's lower than what's outside out here, right? So the air rushes in. Then the pressure is high. What's going to happen to the air once it fills up?
Flows out.
Goes out. So once it gets from low to high, then it's forcefully goes out all by itself without a muscle involved whatsoever. Good. And that's it. That's the basic concept right there. Where is that stuff at? I missed it. How did I miss that? I'm sorry, guys. I'm messing up your recording. There we go. Too bad. All right. Remember we said that the sac surrounding the heart has negative pressure. Again, if someone stabs me in the chest right now, I hope please don't do that. I don't want that to happen. But if someone comes and stabs me in the chest and I break the seal of that negative pressure, what's going to happen? What's going to happen to the lung? It's going to collapse. And the fancy word for a collapsed lung is called a what? Nope. What did you say? No, not yet. That's a pneumothorax. When the entire lung collapses due to loss of pressure, that is a pneumothorax. Now, if I'm a patient laying in bed and I'm not taking deep breaths and I'm not opening up those alveoli all the way at the ends, what's going to happen to those alveoli? The little sections are going to collapse of the alveoli. So when a small section collapses, that's called atelectasis. Okay? When the whole lung collapses due to loss of pressure, that's a pneumothorax. Understand the difference in those two. Atelectasis, from not breathing deep. Pneumothorax, someone stabbed me in the chest. The whole thing collapses. Got it? Okay, good. I want to make sure I covered that because it's on here somewhere, but I missed it. All right, different types of breathing. What is normal breathing, just not exercising, just normal in and out breathing called? It's called tidal volume. What is it called when what is the leftover air just in general called? Residual. What is it when I take an inhale and then I inhale more after that? That's called what? That's Inspiratory Reserve. And when you do the opposite, when I exhale normally and then exhale forcefully after that, that would be Expiratory Reserve. Now both of those combined is what? Maximum inhale, maximum exhale. That's vital capacity. So vital capacity is those two combined. Total lung capacity is just how much air does your lungs fill. How much does your lungs hold, period. That's the difference in those guys. Right? Remember, the other word we said from high concentration to low concentration, we changed the word from concentration of those gases to what word instead? Pressure. Okay? So it's always going from high to low pressure or concentration, but the book is now using the word pressure. We already said it happens in the alveoli. What do we call a hemoglobin? Has oxygen on it? Oxyhemoglobin. Good. That's it.